This morning's forum topic is focused on AICHO, the American Indian Community Housing Organization's updates on how it's responding to community needs as a result of COVID-19. AICHO, as we know, is UUCD's Woven Basket recipient for the month of November. And we'll put a link where, if you haven't yet, you can donate online for the Woven Basket recipient in the chat here in just a little bit. But before I pass it to LeAnn, I just wanted to do a brief introduction and biography. LeAnn is currently the Economic Development Director at AICHO, with over 25 years in the nonprofit and policy advocacy sectors, which includes direct services, development, and executive director roles. LeAnn carries a deep commitment to community leadership. She's on a leadership team to develop Indigenous social enterprises focused on housing, arts and culture, and Indigenous food. She holds a bachelor's in education, a master's in advocacy and political leadership, and a master's in education. We are so grateful to have you on the line joining us this morning, LeAnn. And with that, I will make sure to pass the baton to you. And we're all looking forward to learning all of the wisdom you'll share.
Great. All right. Thank you. Thank you. Yeah. My name is LeAnn Littlewolf, and I think I know a few friends on the call here this morning. My Indian name is Andisogija Indigo, and Inga Nindu Dame and Gazagaska Jimekag Unjaba. So my real name is Everyday, and I belong to the Wolf Clan, and I come from Leech Lake. My family comes from Leech Lake Nation. Just to kind of a heads up, I have a dog who, if he gets startled, he starts to bark very loudly, and he sounds pretty ferocious, but he's pretty sweet. So I'm hoping that doesn't happen while I do talk with you this morning. I do want to thank everyone for being here and taking time to visit. I'm going to talk a little bit about AICHO and what we've been doing with COVID in response to COVID, and really around our community response. And then at the end, if you have any questions or if you want to have a conversation, then I think there's going to be a lot of time for us to be able to do that. Before we started, I smudged here in my home, and I have a sema in my hand, which a lot of times when I'm speaking, I do it also as a form of prayer. So I just wanted to let you know that as well. In a sema, that's our traditional vessel for prayer. It's our tobacco. And so after I finish speaking, I will go put this out. So just want to say miigwech again for everyone for being here. And then really happy to share with you about AICHO. So AICHO is a nonprofit here in town. It's been in place since 1993. We have a mission to honor the resiliency of Indigenous people by strengthening communities and centering our values in all aspects of our work. And I hope that as I talk through some of the things that are happening at AICHO over the past several months, that you'll see that mission is very much centered in everything that we do. And today I'm going to talk a little bit about our response to COVID. So mid-March, I know like March 11th, I was down in St. Paul at the Capitol for the Minnesota Coalition for the Homeless, and for the it was the Housing Day on the Hill. And so we were down there advocating for housing programs. And when I was down in St. Paul, Minneapolis that day, that's when all of the announcements of like cancellations, that COVID cases had started in Minnesota, and that things were going to change. And so I was down in the cities for 2 days, and then when I came to Duluth, it felt a little less urgent up here. And then as a team, as an AICHO team, we met, and I said, no, this is really going to be serious, and we're going to have to talk about how we're going to change our practices and how and in response. And then we also started to receive information that, and this is way before we knew that there was going to be a stay in place order, but there was conversation that these were going to start happening, and we had to have conversations about what that was going to look like and what that would mean for our community. So right now, today, we have 3,373 positive COVID cases in St. Louis County. In our state, we have 148,472. And what part of what I have started to do in my position is to really keep track of the data and watch the if their cases are holding steady, if they're escalating, that. So since March, I really been paying attention, and I would say that beginning of August here in our county is where I started to see the pace really pick up. And I would say that beginning of August we had around 400 cases to now, we're at the end of well, we're beginning of November, but we're at 3,000, over 3,000 cases. So it has really, increased pretty fast. Um, so in response, here, this is a picture of our Gamaji building downtown. We have 29 units of permanent supportive housing, and we would provide, we have a drop-in center in the lobby, so people could come in and get coffee and water, visit. We had a lot of events happening in our building, over 300 events at our Dr. Robert Powell's Cultural Center each year. So we closed all public spaces. We had no visitors. We had to take, and these are just reflective of a lot of practices that happened across the community. Took out our water dispensers, our coffee. We provide meals on site for the permanent supportive housing residents. So we usually would have those down in our foyer. We had to change our practice there and close our kitchen to only the staff that were preparing food, and then individually package that food and deliver it up to households. Right away, we started encouraging people to stay at home when possible. We started to gather information about the health risks with COVID, what some of the symptoms were, what happens when people have COVID, what are the potential health risks with that, and getting that information out to our program participants. So we changed a lot of practices really fast, and we were gathering as much information as possible. And I think one of the best things that happened is that the governor's office and Senator Smith reached out to us and other Native urban organizations and had a conference call with us and gave us updates about what they were doing at their level, and then also asking us what our community concerns were. And then the governor's office set up a weekly call with his staff to talk with urban Native organizations. And I think having that kind of really immediate information made a critical difference in our community. And then we were approached by MDH if we would want to be a part of a cohort of Native organizations that could help take health information, give them feedback on how it resonates with our community, and then also give us an opportunity to take those important health messages and share that in a culturally relevant way with our community. So we started to meet weekly with other organizations, and it was a really great space because we also were able to reflect on the information that they had and when they were responsive. So for example, there was a time when there was an infographic flyer that was about if you're going to go to the grocery store, here's the best practices when you go, like make sure you have a list, make sure you go in as quick as possible. So all of us looked at that flyer and it was, quiet. And then finally someone said, well, this is great, if you have a 2-parent household, or if you have, but it doesn't work because we have a lot of single parent households, and it's really hard to figure out, like, if you're going to go to the grocery store, where are your kids going to be? Because you can't leave them at home, you can't have them wait in the car, and you can't have them go in the grocery store with you. So this flyer doesn't really make sense to our community. And then we have a lot of grandparents who are parenting their grandchildren, who they really need to stay home. So we have to figure out some other strategies. So we were able to give that feedback back to the state, and then for them to become more informed really about what the community's issues are, what the community needs are. And then we just had this ongoing dialogue throughout. So I just want to share, like, so some of the information that we were able to help with is we had contracts with Indigenous artists to come up with beautiful art pieces that shared these messages. And we sent these out via social media, so like our Facebook, but then we also made print posters that went out into the community so that they were positive messages, because a lot of people were kind of resistant to staying home. And so this was a way for us to say, like, this is really about all of us staying healthy. It's about protecting our elders. It's about protecting each other, and that we're in this together. And that kind of messaging really works in our community. And this is a beautiful art piece. And this is the women with the jiggle dress, and that's a healing dress. And people, when they see it, they get that. They know what that means, and they know that that's our value. We had artists who made coloring sheets for kids. So again, like it's beautiful artwork. And then it has these messages, these basic messages that go along with COVID. And then the kids, the children helped make a flyer where they came up with the saying "mask up," and then offered to be our models for the poster. So, and then the masks that they're wearing are from Leah Yellowbird. She wanted to come up with a mask that kids would have fun wearing, so it was really a community collaborative effort. And then another piece that we did is that at times when there were information gaps, we were able to help out. So when COVID-19 saliva testing was set up, we hadn't seen any flyers. And so we were able to really quickly work with our graphic designer, Mary Villiard, to come up with one, and then to help get that information out like right away. And so that was not necessarily with MDH. That was really just like a kind of like a spontaneous response that we need to help get the word out about this. With the stay in place orders, AICHO started to, we did emergency food boxes, 14-day boxes. As the order was extended, we ended up doing those boxes 5 different times to all of the Gamaji residents, and then also to the Giwe, which is a intensive mobile case management team for households who have been long-term homeless, and then also with our Indaji, which is it's affordable housing units. And so we also did some beginning support with the distance learning, helping people get access to laptops. We extended our Wi-Fi to make sure that households would be able to get onto the internet, get online and be able to participate in school. But then we knew that was like a short-term immediate response. And then over the summer, we talked about like that if students weren't going to be able to go back to school and they needed to distance learn, they weren't getting what they needed. So we had to figure out another plan. So we created a learning center that's socially distant. It has this socially distance in it. And then it also has like activities in the gym. It has cleaning schedules, and everything is sanitized. And then there's meals included, so it's all healthy food. And then we're outside as much as possible, again, with the kids doing the gardening. This last October was Domestic Violence Awareness Month. And so with COVID, we've seen an increase in the number of calls to our shelter, Dabanuagan. And actually what happened is we went through the shelter, and our current shelter is it's a very small space. And a lot of those spaces are shared spaces. There's no way to really social distance. There's a small kitchen, there's a small living room, and then small rooms where a lot of times where the beds are, you have to share with people that are not part of your household. So we have 10 beds in that shelter, and we actually had to reduce that down to 5 beds. We were able to convert a couple of units into isolation units. So a couple families were able to access those units, but we just knew that we need to have more shelter space because we've had more calls. And then we need to make sure that they are COVID safe. So right now we're working on an expansion that will bring the beds up to 24 beds, and there'll be 5 separate units. So a household can have a sleeping quarters and a living area. We also secured funding to start a commercial kitchen so that the food can be prepared there, and then also again like individually packaged and delivered to the residents. So we're working on that shelter expansion right now, and we are going to have a job trainings program in construction. So we'll have, I think it's 3 positions that will learn hands-on job renovation and construction skills. And then that Dabanuagun, again, that's our emergency shelter. And we usually serve between 130 and 150 individuals each year. And that's generally women and children. And it's everyone who accesses the shelter is fleeing violence. And then I want to talk a little bit about Mewan Market. So just to kind of go back, that AICHO in July 2018 bought the 4th Street Market. It had been vacant for 2 years. We have intentions to turn this into our Mewan Indigenous Foods Market, a corner grocery store that will have like fresh, healthy food, staples, and then also have retail space that will feature Indigenous food. There will be a coffee shop deli area with community gathering space. So that's still in the works. We're fundraising for that right now. And how this ties into COVID is that because we had started to do emergency food within our program, the state, we've partnered with the state to, that's Fenris, that's my dog, sorry. We've partnered with the state to do emergency food distribution specific to COVID, working with the Office of Economic Opportunity and with the American Indian Cancer Foundation. So we secured money to buy food, and then we secured money for equipment. So we set up the undeveloped space into where we're storing the food. And then we were going to start doing this last week. We started to do distribution. So it was curbside pickup or delivery for elder households or households that need to quarantine, which makes a huge difference if you can't go out and if you don't have transportation, you don't have a support network. It is really critical. And AICHO has always been really focused on buying high quality, fresh, like nutrient dense food. We're really committed that our community needs to have really good nutrition. And then along with that, also household items like cleaning products, and then also PPE. And one of the other things that happened during this time is that the state of Minnesota needed someone to help distribute personal protective equipment out to tribal communities. So we worked with them to do that, and we sent it out to other Native organizations. We purchased and then we distributed out to other Native organizations, and then also to tribal nations. Tribal nations also had received their own PPE, but sometimes different departments were not having access to it. So we kind of helped fill in the gaps. But we sent PPE out to clinics, assisted living facilities, domestic violence emergency shelters, and homeless like shelters for people who don't have housing. So that was really critical to start doing that. And it was really, for us, a learning experience about the need for really good communications and really good networking. And it was shocking to us, some of the areas of people where they didn't have access to face masks and hand sanitizer, just the very basic PPE. And then last week, AICHO got a call from USDA saying that they had food and if we wanted to help distribute, and we said yes. We didn't know it was going to be a semi truck full of food. We didn't have a way to actually get those big boxes off of the truck. And so Scott, who's here in the red hat, he called Essentia and said, we have a semi full of food, of emergency food that can go out to our community, but we can't get it off the truck. And Essentia sent up a forklift and 4 workers to help unload it. And 500 boxes went out of food, and we're getting more food this week again. And the staff said that people were in tears when they were getting the food because there's such a desperate need right now. So for us, it's like that we have the space and we have the ability to mobilize quickly and get those resources out to our community, and really and to do it in a good way, because we frame everything from our cultural values around we take care of each other, like we help each other. That's what we do as a community. We're here to help each other. And so it's a with great humility and to be able to be in place to do that kind of work. This is just a picture of the forklift and then the food that was going out. Um, and then this is just a little poster that the kids put together. They picked out what messages they wanted to send, and they're learning about civic engagement and the distant learning. And I wanted to share that with you. So I tucked that in there. This is our contact information here. I'm trying to think if there was anything, I just think that we have really taken COVID very seriously, that the health impact in our community, we're really concerned about how that's going to, how that could potentially cause a great deal of devastation. We don't want to lose our community members. We have a lot of health risks. And then economically, we've had a lot of challenges for a long time. And so whenever these kind of community crises happen, they hit our community a little bit harder. We don't have, not everybody has enough money to go out and get 2 weeks supply of food. A lot of people were in service level jobs, and so they lost their employment. And so as a community organization, those are the things that we talk about, and we try to strategize, and we try to figure out, like, how can we build resources quickly, and how can we help our community right now get through this, and then at the same time strengthen our community cohesion, that we're stronger. So that has really been the focus. We're really excited about the shelter expansion. It's much needed. We have, I've shared this a number of times, I think, and I try to share it as many times as I can, is that with the 10 beds, we usually have 130 to 150 people that stay each year, and they're fleeing crisis situations. They're fleeing violence. They're fleeing domestic violence. They need a safe place to be. They're usually arriving with nothing. And then we still have over 550 calls each year that we have to turn away because our shelter is full. So the need is really high, and we can't ever, we want to keep, last month was really important to do that awareness, because it's an issue that's not going away. We have to really get resources and continue to work hard to really address it. So I'm excited about that shelter expansion. 24 beds, and that's going to be very secure and very safe. So I guess that's what I have right now. And I don't know if there's any questions.
Oh, I'm sure there is, LeAnn, and we are just all so grateful for the ability to just have you provide a direct update here across the board. I have just changed the setting for everyone so that you can unmute yourself if you click on the little microphone icon. And we have a good half hour here to jump into anything that people might be curious about. I don't know, LeAnn, if you also wanted to look at the chat here, but I think that there's a couple of questions coming in that way, and a reminder that people can also click on their little microphone icon in the lower left of your Zoom toolbar, and that unmutes you as well.
Let me.
I have a question for LeAnn. If I recall, your emergency shelter now is right there in Gamaji. Is this going to require you to find another building and build out the shelter that way?
So Davidogun's always been off. It's been its own. It's a building that's off, right? And it's not, the space was not disclosed for safety purposes. Yeah. But now actually, I'm not sure, we are actually working on space within the Gamaji building to do the shelter expansion. So that way all of our services will be more centrally located. And then the building itself, Gamaji, already has security systems set in place. We have 24-hour staff, and we have a security camera system, and we have protocols set in place. So we would just enhance that. That would really work for the domestic violence security needs. So that's what we're working on right now. Okay. I'm not sure what the next plans are to use the space where the current shelter is at. But we do have a huge housing need in Duluth right now, and we have a lot of community members who are unsheltered, more than I've ever seen before. people who are out on the street, and people who have set up camps. And there's a number of camps throughout Duluth that are where people are living outside, and I believe that there's families that are living outside with children. So that's an urgent issue, and that's something I know that the city will have warming centers and that those will be available. And I know that CHUM is also working on, increasing their shelter space. And again, the challenge is making sure that everything is COVID safe, and that and so that's kind of where we're at.
So there is space in that building still unused in the Gamaji building. That's
there. Yeah, yes.
Wow. Yeah.
That's
great. That is, yeah. Go ahead.
Oh, that the undeveloped space has kind of been up, like we've had a number of discussions about many different ideas in that space, and like exciting ideas, that we had. And one of them was an idea for a large commercial kitchen that would be able to, that would be accessible to entrepreneurs and food producers. So there's going to be a smaller commercial kitchen, and that was we just got funding from St. Louis County, a new innovation grant that they had. And so we are going to this next year be working on getting that commercial kitchen space set up. And initially that is going to be used for the Gamaji residents, and then for the shelter residents. And then we'll be working on a plan to open up access for food producers to be able to use that space. And we're excited about that. And I know that there's other conversations in our community about another commercial kitchen opening up, kind of with the same concept, but maybe at a bigger scale. So I think that the one thing with COVID is just the emphasis on local, that we need to have really good local food system, and to have access, and to really, really support our local food producers. And maybe, I just I'll talk a little bit about some of the things that we did with the native food producers this summer. So when we were putting together emergency food boxes, we wanted to make sure that there was native foods featured in those, offered in those boxes. So we started to purchase food from local producers. We have a number of native businesses in the area. And so we purchased directly from them. We made sure that those items were in those food boxes. And then this summer, AICHO also worked with a local native farm to start a native CSA. And so there were so many spots that were open and offered, and there were different lengths of time that people could sign up for it. But those were sold very quickly. And they featured like wild rice, smoked white fish, different items like that, along with fresh vegetables and produce. So for that farm, that generated $7,000 in income, and that made a huge difference to that family. And so I think, at the same time, we are working on our food initiative and really trying to just greater emphasis on that we have a lot of food producers in our area, and that we want to support them. Some of the native businesses lost customers, they lost opportunities at different markets. So the way that we were able to help them is that through Indigenous First, our gift shop, we closed the shop right away. So it wasn't available for shopping, but we launched a website, and then the website really took off. And then instead of the art items, it was really the food items that really were selling. And so again, that went directly back to those native food producers. And that's the whole idea behind the Niwan Market, is that there's going to be groceries there for the community, which, Central Hillside needs a little grocery store with just like staples like eggs, bread, those items. But then also a retail space for native food producers to really show like what food products that they have, and people are really excited about that. So that really showed in the online sales. And then our gift shop coordinator Jasmine, she made these food boxes that had a lot of items that were packaged together, and those boxes sold really quickly. and they continue to be popular. And we just had some of the local bands have been working to get the food items out to their members as well. So we had a number of orders come in from local tribal bands.
I see that Robbie's also unmuted. Robbie, if you had a question, please feel free to have space.
I think it's wonderful using the food shop for all of this it helps to explore what works and doesn't work. And then you know how better to finish the interior. And it sounds like you're doing a beautiful job. And with my experience as a home economics teacher in food and nutrition, I rejoice in all of the strong foods that you have that are nutrient dense, and feature them and get them out to people who need them. Thanks so much.
Thank you.
Thank you, Robbie. It's great to hear your voice. Therese and Luis have a couple questions here in the chat. LeAnn, if you wanted to speak to flu shots and the garden run by AICHO.
Yes. So we still had the garden going this year. It goes every year. And then the kids help. We had to figure out how to make sure that we were doing that with a socially distance, with socially distancing. But our garden is still up and going. And then with the flu shot, one thing that we're working on right now is for Gamaji to be a mobile testing site for COVID. And I'm not sure if flu shots are going to be offered as well. I'm not directly working on getting that organized, but I know AICHO is working with St. Louis County to get that set up. Probably within the next 2 to 3 weeks should be open. And I think the first time it's really to kind of get the testing available for Gamaji and AICHO program participants, and then to open it up. So those details are still coming.
One question I guess I have personally, and just getting back to the whole homeless crisis that Duluth's facing right now. I know obviously it's been covered in the Duluth News Tribune, and Loaves and Fishes and other communities have been really spotlighting this 4-point pledge for the council to take to really expand the warming center hours and the hygiene facilities available. Do you have any recommendations or thoughts as far as what AICHO has really been pushing for as far as the best pathway to really boost awareness and get the council to move forward, that concerned citizens here on the line can also be a part of forwarding in that coalition?
For one, I just think that it's so important that we have to stay, we have to keep updated on what's happening. And yeah, I think we do have to push for concrete solutions. So yes, the warming centers are a solution. Shelter, for a long time, I worked at Lifehouse for a long time working with youth, and during my time there, the emphasis was on permanent housing and either transitional housing or permanent housing, which is needed, but also you have to have shelter space. And as a housing advocate, many times at the end of the day, there was no shelter available for those young people, and where would they go? It was to come back, check back the next day, and we'll start working again on trying to find housing. And I'm so grateful in this community that now we have youth shelter space that is so critical, that was so needed for such a long time. We're very fortunate to have that. I think, the main thing is to be aware of the resources that we have now, that we have a strong continuum of services for youth. I think that family shelter is really needed. And I think that's something that our community can come together and kind of help figure that out. So that's one piece. And then I think that affordable housing is really necessary here in Duluth. Our city has done a number of studies on the issue. We know that we need at least 1,000 units. So we need to be doing some housing development. Those take public support. And just, to me, those are some of the things that can happen. And we have a continuum of housing providers. that work on solutions, and some of these housing developments, they can take several years to get going, but it's like along the way, there's a lot of opportunities to really support them. So there's a continuum of responses. The other thing that I think is really necessary is culturally specific outreach. So the one thing is that we have a lot of Native people who are staying out in camps. They're staying out in places where it's safe for them. So they're away from other people. They might not necessarily be known by other housing providers where they're at. And then we see in AIM, there's a local grassroots chapter of AIM that has been doing outreach. They have been bringing food. They have been bringing supplies to those camps. But they, and again, like, I don't know if AIM is really resourced. It could be just grassroots community members who are limited with resources, who are sharing what they have with these people who don't have anything. So I think that, to pay attention to those kind of dynamics as well. And just to talk about with a racial equity lens, is that people of color are really hit hard with housing crisis and housing instability. So, so I think that we have to pay attention to those nuances in like people who don't have housing, and try to do some specific problem solving with that. In the state of Minnesota, African American and Black community members, the amount of homelessness has dramatically gone up. And I think that's true for our city as well. And I think that Native people in Duluth and specifically St. Louis County have been at a higher rate of homelessness. And, it's just to be aware of, I don't know if everyone's really aware of that, but that's something that I hope that we become more aware of. And then we start talking more about, again, like, just like your question, like, what are the solutions? And now the other piece here is that we have, I think that some of the housing issues it's tied to trauma and to having experienced a number of traumas across a lifetime. And I think that there's generational trauma and there's historic trauma that we haven't always acknowledged, and that impacts people's ability to be successful in life. And that trauma interventions and to have a trauma-informed approach is absolutely necessary to really look at the housing issue. So I'll say that too.
Please, we have tons of space, so anyone on the line, feel free to unmute. LeAnn, thank you so much for sharing your essential perspective here and encouragement to really take our own approach and look at this in ways that we can really improve the situation.
You mentioned you needed 1,000 new units of low-income housing. That seems like a lot is for a city our size. Did I hear that correctly?
Mm-hmm. That's it's 1,000 units of affordable housing that the city needs, and that was done through a report is called the Maxfield's report, and the city commissioned that report, and that was what the finding was.
Good morning, LeAnn. This is Louise. Hey, I'm just curious. I've worked with people of color on historic trauma, and I know that it's a delicate situation. Would you be willing to describe a few more ways to be for those of us who are allies, to be more respectful in the trauma, in the realm of trauma and psychological stresses?
In like in one-to-one interactions, or
exactly,
like
exactly. Yep.
Okay.
Thank you.
Yeah, of course. So one thing is just for people, in trauma-informed response. Okay, so like when I started working at AICHO in 2017, I was hired as an advocate specialist to create some culturally specific training to respond to violence. So for victim survivors of domestic violence or victim survivors of sexual assault. So as I started that position, I did a lot of research on like what the violence data was. And Native people experience violence at much greater, higher rates. It's across a lifetime. It's multiple experiences. It's either witnessing violence or again, like being a victim survivor of that violence. And so then you have to understand trauma. So then I was like, so we're always talking about that our mission is to strengthen resiliency. And so then I'm like, okay, so how do we strengthen resiliency, and what is resiliency? So I started with these questions, and I started to do research. And resiliency helps offset trauma. Resiliency is not like I'm just a really strong person and I get through it. Resiliency is actually my connections to other people, right? So the stronger connections I have to others, the more resilient I become. And those relationships are transparent. And so then like we don't hide information, we share everything out in the open. You develop trust, you make sure that safety is established. And then the person has agency, so that if I've gone through a trauma, then I need to have some choice and my options. I need to know my options. I need to have choice in that. And I have to have my own agency to make my own decisions. So so I did this research, and we wanted to apply this to like the way that we set up our policies for our shelter, that they were person-centered, that they were victim-centered, that they honored those principles of strengthening resiliency. So we had to take a look at and we had a consultant come in and actually help us do this, who created a new kind of policy manual for our staff and for the way that we operate. So you have to understand what resiliency is, and that helps offset trauma. But then you have to get to like, what is trauma? And so like I'd be in a meeting and I'd hear someone make a comment like, I just had a really traumatic week. And they were talking about they had a really difficult week, you know? And so we kind of use that word trauma kind of loosely in a way. But so trauma is like when you believe, or you're gonna, it's a life or death situation, or great harm's gonna come to you. And then that triggers a response in our brains where we want to protect ourselves. And there's a number of ways that individuals can respond, but you just have to understand like what those responses are. And then you can start to be helpful. You know, we as a community, I feel like we really have to understand what trauma looks like, how it impacts our brains and then our bodies, and then what people are actually going through. And then if you think about a person who's been through, like if they were through a car accident, that's a trauma. How has that impacted them? How do they not get stuck in that trauma? And then how do they move forward? But then you think about across a lifespan, if someone has had those real trauma as children, as young children, as teenagers, as adults, or what if the generation before them had a lot of those traumatic events happen with no intervention? And then what if you have had a community that had traumatic things, like where their people were violently assaulted or killed, and there was no intervention, and then you add all of that together. So I know I get really passionate about this issue, because when I look at the conditions of our communities, a lot of it goes back to this issue of violence, right? Of violence in our community and the harm that it causes, and it ripples out, and we have to have better interventions for people, you know. And I think about, because I help with grant writing, I get given a lot of data, and I have to make sense out of it. So we do an intake at Gamaji, and so they said, could you help us write this request? Here's some of our information. So I'm looking at the information. I was like, wow, this is incredible. 90% of the people who come into Gamaji on intake say that they have either witnessed or been a victim of violence. Almost everyone. And then those are the adults. So this is really what got me, is like, then I'm like, and these are children. So at Gamaji, we have 29 units and we have 30 to 40 adults, and we usually have 40 to 50 children. So then I was like, so most likely all of these children have witnessed or been victims of violence. So what are we doing in response? And then I started to think back to my childhood, and my very first memory as a toddler is watching someone assault another person. That's my first memory. And then I thought about my own life, about how no one talked to me about that violence. Nobody helped me make sense out of that violence. Nobody helped me say, like, you're safe, and like, do you, and to do a response. And I thought, okay, so here I am, I'm 47 years old. And in the span of 4 to 5 decades, what are we doing different? And so then that's why I'm like, we need to really look at this. What is trauma-informed response? And what do these children need? And what does our community need? So yeah, I get really passionate about having a trauma-informed approach. And I've worked for a long time, almost my whole life, in like housing advocacy. And I would say that the work I did at Lifehouse, I was there for almost 9 years, working day in, day out with young people, and in the root of their difficulties and their challenges in life goes back to that kind of trauma. So if we want to do a housing approach, I really think that we got to pay attention to the issue of trauma, and making sure that as either service providers or community members, that we're figuring out.
I also want to point out that the way that Unitarians in our church can easily give some money, we're doing online simple giving, and Brett did put that in the chat before he left. So I'd encourage everybody to click onto that if you haven't already done so, and get out your credit card and give a little money, because I think money is always the easiest way for organizations to use it for resources. So is there one more question for LeAnn before we wrap up here? Looks like Therese has one.
Well, LeAnn, we're participating in this Becoming a Good Relative classes with Moose Jaw, Minnesota Unitarian Social Justice Association. So trying to get woke about trauma and cultural misappropriation and everything. As a community, UUCD, if we wanted to serve AICHO, do you have one thing that pops up besides, like, I loved that gift shop whenever I travel, and now we're going to go to Portland to see my kids, and I go to that gift shop and bring local produce. Is there anything right now you can think of, if we were to serve, besides the woven basket and money? Thanks, Kat, for bringing that up. Anything else if we had more time than money?
Yeah. So for me, I always think it's about relationship. And so I think like being here this morning with you and visiting, like, to me, this is really relationship building, and to have time to talk and to share. I think that relationship building goes a long ways. So opportunities to do that for other community members to come in, maybe if there's issues that you're really interested in and having dialogue or conversation about, or learning, cultural learning, like cross-cultural learning is greatly needed in our communities. It's greatly needed. And to not be afraid to come into relationship. I think that's really critical. And I think and in many different ways across the world, we need that right now. We need that more than ever. So I think that would be one way. One thing we have tried to do is at AICHO is to have events for people to have a welcoming space where people can come in and learn more. And we do have events that have like issues that are really pressing. So like we'll have like climate change issues, environment issues, and we always bring an Indigenous perspective to those issues. And I think that the more that we can have those kind of dialogues, it's really critical. So I think that that might be an idea. Maybe to have visits with other Indigenous people too, like one-on-one, and do some brainstorming. That might be helpful too. So I thank you so much for all the time today. And I didn't put my email on the, but I'll put it in the chat here. Let's see. Oh, I have to.
LeAnn, I hope you don't mind. I'm just going to put in here. I greatly appreciated. I wanted to circle back to what you'd said about PTSD. I too have been doing a lot. I had foster sons who are Native American. They're Dakota, and it was extremely eye-opening to understand what historic trauma really is and how to be responsive, particularly to young people, but the elders as well. You know, it literally shortens people's lives when they have to deal with significant historic trauma. And
Yes.
thank you for highlighting the resiliency and how resiliency is brought on by people having honest to God, real choices, you know, and being able to have agency over what does and doesn't happen in their world.
Yep. Yep. No, thank you for the starting that conversation. And I mean, again, it's just something I'm very passionate about. And anytime I would like to have more conversation about that, you know, I'm certainly would love to do that. There is a film, you know, UMD did screen this last year. It's called Dodging Bullets. And it's it's a documentary, and it does talk about historic trauma as far as it relates to American Indian people. And it's available online, and it is available free in different, so you could just Google search that, but that's a good place to start too. And you know, and again, I know that you have to transition, you have service this morning, but I just want to say miigwech to everyone for being here and listening, and then also for the questions and for the dialogue, and actually for being here in relationship with AICHO and with myself. So miigwech. And I think I'm co-host, so I think I'll close out this room.
You know, actually, we're not. I'm co-host too, so we're not going to close until Sally Munger tells us about the upcoming forums. But again,
okay.
On behalf of our congregation, LeAnn, you're a rock star, and what your community has done with respect to COVID is a model for everybody, and especially that part about, hey, we believe in taking care of each other. That's a concept. We're going to stick with that. So I'm going to turn it over to Sally Munger to tell us about the upcoming forum, and then we hope many of you will switch over to the different Zoom for the service. Sally.
You know, guess what? This isn't Sally. This is her husband, Will. And
Will talk. Okay. All right. Go ahead.
Sally's got me down for leading a discussion next week about the election results. And I know what you're all thinking. You're all thinking, I've had just about enough of these elections. But unfortunately, in a democratic society like we're in, the process is only half the job. Now we have to see that these new concepts and new things that we want to see in our society are implemented. You know, how good would it be if we had a society that had free medical care accessible to everybody, and we had opportunities for equal wealth? And you can go down the list of all the things that, you know, and all these things, you know, they're considered to be radical by some people. And to me, I think they're what our expectations should be. So I think next week we can have a nice discussion of these things and in the forum. Yeah. That's it.
Thank you, Sally, for clarifying. It was in the forum, not just like Will Munger talking. So excellent. I want to thank everybody for coming this morning, especially LeAnn. And we're going to be wrapping this up now. This has also been recorded, so it will be available online for those of you that missed it or want to watch it again. So again, thanks very much. And we'll see some of you at the service.
Thanks, LeAnn. Great job.
Yeah, you guys, wonderful. Thank you. Thank you all.